One boy is playing badminton with his friends. He feels very tired, so he sits down to rest. His friend sees the boy sitting down on the floor and comes to ask with concern. Are you okay?
No, I feel tightness and pain in my chest, dizziness, difficulty breathing, and palpitation. It could be a symptom of my underlying condition, which is Angina Pectoris.
Okay, you should sit down and avoid moving or exerting yourself. I will call for an ambulance. Hello, I'm calling from the badminton court at Thammasat University. I have a patient experiencing tightness and pain in the chest, dizziness, difficulty breathing, and palpitation. He said it could be a symptom of his underlying condition, which is angina pectoris. Could you please send an ambulance?
I will send an ambulance as soon as possible. In the meantime, you should have the patient sit and rest, avoiding exertion or movement until the ambulance arrives.
What brings you here today?
An ambulance. Oh, sorry. I feel tightness, pressure, and pain in my chest. I have difficulty breathing, dizziness, and palpitation. This occurs after exercising with my friend. It could be a symptom of my underlying condition, which is angina pectoris.
Oh, I got it. You are right. It's definitely a symptom of angina pectoris. It's a discomfort in the chest, often described as a tightness, pressure, or pain, typically relating to the jaw, shoulder, or left arm. It may be accompanied by difficulty breathing, dizziness, and palpitations. Symptoms often occur during exercise or times of emotional stress and tend to subside or disappear after the patient leaves. The symptoms of angina pectoris can vary from person to person, but they commonly include 1. Chest discomfort. This is often described as a partial tightness, squeezing, or burning sensation in the chest. It may feel like a heavy weight is pressing on the chest. 2. Pain or discomfort in the outer areas. Angina can also cause discomfort in the neck, jaw, shoulders, arms, especially the left arm, back, or upper abdomen. The discomfort may radiate from the chest to this area. 3. Shortness of breath. Some people with angina may experience difficulty breathing, especially during physical activity or when experiencing chest pain. 4. Nausea. Angina may be accompanied by feeling of nausea or indigestion. 5. Fatigue. Many people with angina feel tired or fatigued, especially during episodes of chest pain. 6. Anxiety. Angina episodes can cause feeling of anxiety or fear, especially if the patient is unsure about the cause of their symptoms. It's important to know that the symptoms of angina can vary in severity and duration. They may also be triggered or worsened by physical exertion, emotional stress, cold weather, heavy meals, or other factors that increase the workload on the heart. Do you experience these symptoms while resting, sleeping, or not?
No, I only experience these symptoms when I exercise.
Is it every time you exercise?
No, only when I exercise intensely.
Normally, there are two treatment options for angina pectoris: symptom-based method or conservative. Medical method include medication treatment, lifestyle modification, and cardiac rehabilitation. Coronary angiogram-based method involves revascularization either through catheter-based therapy, interventional or coronary bypass graft surgery. But in your case, I think you don't need surgery. I will prescribe medication for you to take, and the nurse will provide guidance on lifestyle modification to help prevent worsening of symptoms.
Hello, you have angina pectoris. The doctor prescribed medication to take. Please take the medication on time and adjust your behavior accordingly. Quit smoking or avoid exposure to secondhand smoke. Manage weight and exercise regularly as per the physician's advice. Avoid overexertion during physical activities and take regular breaks. Consume a healthy diet rich in whole grains, fruits, and vegetables while avoiding high fat and large meals. Manage conditions like diabetes, high blood pressure, or high cholesterol. Avoid stress and find relaxation techniques. Consult a healthcare professional if self-help methods are insufficient.
I have a question. I want to know what the cause of this symptom is.
The overall cause is an imbalance between oxygen demand and oxygen supply, which can occur in two forms. 1. Inadequate oxygen supply to nourish the heart muscle. 2. Increased oxygen demand by the heart muscle. Classification of angina pectoris. Stable angina. Classic effort angina. Cause: coronary arteriosclerosis. Atherosclerosis in the artery supplying the heart. Symptoms last less than 10 to 13 minutes after discontinuing the effort. Examples of angina episodes: exercise, host, anger, stress. Unstable angina. Patients may have experienced chest pain for the first time or previously had stable angina, but with worsening symptoms, such as increased frequency or duration of pain, or pain occurring at rest or during sleep, often associated with the rupture of an atherosclerotic plaque, leading to platelet activation and blood clotting processes. And the last one, variant angina, vasospastic angina, caused by coronary artery spasm, occurs at rest or during sleep. If you don't know, coronary arteries are the red blood vessels that supply blood to nourish the heart muscle.
Oh, I get it. Thank you for your advice and information.